Honorable members, this sitting is resumed. At the suspension, we were in Standing and Finance Committee, and to that we shall revert.
Honorable Leader of the Opposition.
I'm obliged to you, sir. And this question is for the senior minister, not the junior. I hope they allow you to say something today so that we wouldn't think you're a mannequin. Minister, on 2 occasions, the honorable member for St. Michael South East sought to dismiss the importance of this matter of excluding Barbadians and Caribbean people from consideration for the post of CEO. And although the honorable member dismissed its importance,
Mr. Chairman, the honourable member is leading the House, and knowingly so. I did not make any such suggestion. I've indicated that I felt that this is an important debate and one which we needed to get to the meat of the matter in relation to the issues concerning the people of this country, but more importantly, that the hospital has to put itself in a position to manage. And we're not discriminating against any Barbadian. There's a process, it's been explained, and the honourable member would do well to have listened to what the minister said and to his team in relation to that process.
Thank you. Not only did I listen, but I wrote down what the honorable member said in relation to the hiring of an Englishman, and I refer to nationality and not race. I don't do that. I refer to nationality. Now, to the minister, I am raising this question. The honorable member for St. Michael South East sought to justify the hiring of an Englishman. I don't even know what race the gentleman is. I haven't seen him. They're black people who live in England. They're Indians who live in England. One happens to be the Prime Minister. So the question of race was never raised.
Mr. Chairman, the honourable member is misleading the House. I'm not here to justify the hiring of anyone. Perhaps he needs his own justification for the position he now holds, but I'm not here to justify anybody at the hospital. I have simply made the point that the hospital has to do what the hospital has to do to transform, and the honourable member would do well to stick to what the purpose of this debate is for. Ask his questions.
I will ask the question. Now, I understand the honourable member's disquietude because the other part of the duumvirate is here, and she's upset. The honourable member is upset about that. In fact, you would recall, sir, that the honourable member said that she was not scheduled to answer questions, but she just wanted to get at this minister early. I understand the disquietude.
Mr. Chairman, I will not allow the record to be tainted by the Honourable Leader of the Opposition or to discredit me in any way. I am not after the Honourable Minister of Health, and he knows that. I am here to raise the issues of the people of this country, just as you are, Honourable Leader.
Yes. Well, look, accept that it is a
Or so you say, so you say. And I think that comment ought to be struck from the record, as should the others.
Accept that it is a duumvirate in this country and not a triumvirate. And that this minister is part of the duumvirate.
Honorable Leader of the Opposition.
He has more power than all of you.
Honorable Leader of the Opposition, this debate is about health issues on the Ministry of Health. It is not about who has power, who doesn't have power. Please ask your question and utilize the time that you've been given wisely, the time that you asked for.
I'm being interrupted
and you are allowed.
On the question of power.
He doesn't have power. That's why he's behaving like this.
I'm obliged to you, sir. Minister, the honourable member for St. Michael South East, I wrote down what that honorable member said in relation to the justification of the hiring of a CEO from the North Atlantic. Here is what was said. We have to look for the best minds and the best people. Check YouTube and you see. That is what was said. We have to look for the best minds. And please stop interrupting me. You came late, dressed as you are.
Honorable Leader of the Opposition, we have spoken already with respect to your exchanges across the floor.
But I'm speaking and he shouted at me.
Honorable Member, who is he? You cannot refer to members that way.
The honorable member shouted at me.
Honorable Member, proceed with your question.
Please
and
show
let
him
the
Rule
House
33,
go
sir.
on.
Please show him Rule 33.
I will show you Rule 67.3.
Yes, Minister. And I'm serious. The honorable member for St. Michael South East sought to justify the hiring of the gentleman on the basis of this statement. We have to look for the best minds and the best people. Minister, you are aware that a gentleman came here to head BTMI, and in the time he was here, he tried to say as little as possible to Barbadians and succeeded. He left here, nobody knows his position on anything. So now we have somebody who is described as the best mind and the best people. My simple question to you, Minister, do you adopt that statement as your own justification for the hiring of the gentleman? That I'm asking you, if you place him within the category, within the human category, to the exclusion of young Barbadians and young Caribbean people, do you place him in the category of the best minds and the best people? Simple question.
I didn't, Mr. Honorable Member, I didn't hear the comment to which you referred. I don't recall hearing this. I certainly didn't make any comment about best minds. The chairman who outlined the process made no such comment.
Yes.
So I can't associate myself.
You cannot
with what you're
associate with
saying.
it, you disavow it. I thank you. That's all, sir.
That's your question, Honorable Member?
That is my intervention in response to the honorable member for Southeast. I believe I still reserve my 3 questions when the time comes, when you so call on me.
Honorable Member, that is why I've come to you, because you asked so that we are fair and there's balance. You heard me respond with fairness and balance. I'm not going to do, unless you're asking me to do all government members and then come to you, and that will not be the case. So I'm giving you the opportunity, one of the opportunities that you will have at this time to ask your question.
No, I'm not ready. I'm not ready with my 3 questions yet, sir. So please go to the other, sir. And I know you're tired of hearing, I agree.
One honorable member, I am happy that this is one time you get to direct the chair.
I beg your pardon, sir.
Honorable member for Christchurch West.
Thank you very much, Mr. Chairman. Clearly, from everything that we've heard today, it is absolutely obvious to all those listening that health is a very personal matter. And it goes to the heart of everybody's well-being. As you heard the Deputy Prime Minister relate to her own personal experiences, and as you heard the member for St. Michael West, who also related to his personal experiences. And clearly it shows how important the Ministry of Health is, not only to people in their personal capacity, but also for the country as well. Indeed, it could also be measured by how much money the government spends. In this estimate, some $370 million. One of the, I think the largest or the second largest head that we will be doing today. And obviously why we've extended the time. So health is an extremely important head for which the whole country has a say, a part, and obviously a benefit. My first question Minister, has to do with the expansion plans. And I heard you say that you have $130 million for infrastructure expansion. And I would want you to expand on your expansion plans and share for the benefit of the country what those expansion plans will be, in particular the ones that you want to do over at the Enmore site.
Thank you, Honorable Member. Immediately, the 130 million I mentioned was for CapEx, which is obviously equipment and some infrastructure work in the hospital. I think members might be aware that there has been discussion about expansion of the QEH facility into our campus. We've had issues currently with the laboratory and issues of administration, crowding, and need to expand in the original building. A decision was being made to expand the facility. We're looking at the Enmore site, and as a matter of fact, 3 weeks ago it was that there was a request for information was published in the daily newspaper here, seeking persons who might be interested in undertaking this process. It speaks to a 3 and 4 story expansion. It speaks to a car park facility. If I may go through the various components. You heard me mention earlier concerns about cancer. In those plans, the construction of an oncology center, oncology unit, with linear accelerator, PET scan, the various treatment center areas for chemotherapy treatment, areas for education and discussions, as the honorable member from St. Michael's Office spoke about earlier. A new lab and up to date, and this is not to be confused with the Best of Santos lab, which is a public health lab, and I'm looking at a hospital lab, dedicated lab. There's provision made in there for administration, the various administrative offices, and also for outpatients clinics. In addition, there is provision now being made for a rehabilitation center, because it is something that Barbados needs. We have the issues not only of diabetics and amputees, but we're having increasing trauma, be it human on human or vehicular trauma, and you have younger people who are affected and afflicted. And thought it is time that we had a rehabilitation center for this island, and obviously the people who suffer strokes, etc. So there's provision for that. Car park facilities for the hospital. This has always been an issue. You see people parking all around the area in unsatisfactory and unsafe areas sometimes. And this is to be linked to the hospital by a bridge. That is a proposal from oncology department. There's a bridge that would go across. This is at very early embryonic stages now. I believe there are some initial drawings, etc. And it is a project that the government is looking to get going and get completed probably within the next 2.5 years. This is what I can say on it at this point in time. I wouldn't go in for obvious reasons. I just said we had requests for information. I wouldn't want to go into details here in terms of proposals and the costs, but there is definitely a plan to expand the QEH across into the Enmore area.
Thank you. Thank you very much, Minister. Clearly, that would then, by moving those services out of the hospital itself, then that will obviously give then more opportunities for clinical space within the confines of the Queen Elizabeth Hospital itself as you move more administrative services out of the hospital. I don't know if you want to expand on that.
That is the plan, certainly. There's congestion, we need more space, certainly engineering. They complain about the crowded space there. We also need, as you said, more clinical space. We can expand the clinics that are over there still. And then the matters of expanding stores and stuff like this. And obviously, we are looking at the possibility thereafter of having some additional wards.
Thank you very much, Minister. My second question has to do with information technology and the upgrade of the information technology. You may recall that some estimates ago, I brought up this concept of being able to track how stock is used. And certainly in first world countries, they have barcoded everything as a patient is given a particular medication. You scan the patient's armband, which has a barcode. You scan the medication, and you track not only the medication that is given to that patient, but also the stock levels of medication. As you know, expiry on medication and drugs is a big issue for hospitals and for pharmacies across the health spectrum. And that is one way of tracking what patients are given, which patients are given, how much medication the patient are given, and to track stock levels. So, and I know I haven't seen that at the hospital. I asked about it several times, and I'm going to ask what progress has been made in terms of upgrading the information technology, and in particular, this opportunity to track what medications are given to patients, and then by extension, the stock levels of medications throughout the hospital and all the service.
Thank you, Honourable Member. It is certainly a matter that we have been a trend meeting about and want to address, I'm told, within this year. But I think that we will certainly give it a good shot this year. But I'm going to ask my colleague, Minister Davidson Ishmael, to speak on this matter because he has oversight of this area. And perhaps afterwards, Director Louise Bob.
Thank you, Senior Minister, and thank you, Honourable Member, for the question. You reflected on how long this has been going on, and it brought to my mind the fact that the QH is celebrating 60 years this year. As an institution, the role of ICT across many institutions across Barbados cannot be understated, the important role of ICT, and the QH is no different. Technology has a very critical role to play in the administration and the execution and the delivery of healthcare services. So, in addition to the specific question you've asked, which we will have Director Bob answer, there has been an overall effort to upgrade and enhance the ICT infrastructure at the Queen Elizabeth Hospital. Of course, members of the public, members of the House would be aware that the government of Barbados is in receipt of and has signed off on a grant in the total of just over 4 million euros, specifically to upgrade the QH's ICT infrastructure. That is to help with its digitization and its digitalization of its services. Critical and core to this entire rollout and the development of this digitization effort is a health information system, which, as you rightly stated, will allow for doctors, clinical staff, doctors, nurses, etc., as they administer patient care, to do so more efficiently, to be able to do so with the use of devices and technology that will allow for patient tracking to take place, to allow for the monitoring of patients, not only diagnoses, but all the way through to their treatment and all the way through to pharmacy, and how those stores then are utilized throughout the infrastructure of the hospital. There's been quite a bit of work that has already been done relative to this particular project, this QH-IT upgrade project. We have already established a project team. That is a 4-person team, a project coordinator, a procurement officer, we have a clinical specialist and lead, and we also have a business analyst who have already hit the ground running to help the QH to be able to do an effective needs assessment, department by department, identifying the technologies and the processes that are already in play and in existence, and to see how they can then map and re-engineer those processes so that technology can play a more prominent role and can help the hospital to obviously be more effective in its delivery of its services. This is a 30-month project, and we're well underway in that regard, and we're expecting that, and things are on track relative to the rollout of that. New computer systems in terms of hardware are being procured. You would hear from, and I'll probably ask, in addition to Director Bob, I'll ask the Director of the Management Information Systems, Mr. Bushell, to also come and to speak relative to the more technical upgrades that are already underway and taking place within the hospital, and I'll let them to give a more fulsome expansion on what it is that we're doing. There was, as members would recall, there were some incidents, cybersecurity incidents at the hospital back in 2022, and I must report to this House and to the public that since that incident, there has been significant work done to improve the infrastructure, the ICT infrastructure at the hospital. Members would recall that there were some disruptions of services at that time, and I can confirm that all services have been restored a long time from today's date, but just to confirm that all services have been restored, and not only restored, but have been enhanced and improved significantly. So the cybersecurity infrastructure, the monitoring tools, the detection tools, and of course our response mechanisms have all been enhanced so that we are able to better prepare for any further incidents or future incidents that may take place. So there's been an overall expansion of, yes please, there's been an overall expansion of the ICT platform, understanding that it's going to play a critical role in what we're doing. The health information system is going to allow for all of the various departments at the QH to be able to speak to each other and to interact with each other in a more effective way, so that a patient coming through the A&E, all the way through to the ward, all the way through to discharge, is able to be tracked electronically throughout the system. So I'll stop there at this point in time, not to use up too much of the time, and allow Director Bob to come in, and then she'll be followed by Mr. Bushell, who is the Director, the Manager of Information Systems.
Good morning, Your Honor. My name is Louise Bob. I'm the Director of Support Services at the Queen Elizabeth Hospital. And just to expand on what Minister Ishmael has been speaking about with respect to the progress of the transformation of the hospital, we are well at as we progress in that area. Other modules include the admission, discharge, and transfer system. We're also looking at a patient billing and costing system, the lab system, and an HRIS, which will be not necessarily a part of an HIS, but whatever HRIS we come up with must be interoperable and be able to speak to the HIS. And then there are the clinical order entries and pharmacy chain, supply chain management modules. But along with this major direction that is being taken, we are also looking at other opportunities where technology enhances the operations of the hospital and the patient experience. So for example, some of the accessories that will go along with the health information system is the patient portal. I mean, this is 2024, and we would expect that at this time, individuals subject to the rules and conditions of legislation surrounding data protection should be able to access their own information remotely. So that is one of the major advances that we expect to come out of this exercise. I'll turn over now to our Director of Information Systems at the hospital for him to speak a little bit more of some of the other technology that will be complementary to this advancement in health information systems.
Good morning, Your Honor. My name is Hadley Bushell. I'm the Manager Information Systems at QEH. In addition to what Director Bob has indicated, the project also will look at the supportive enabling environment for the hospital information system. And so therefore we'll be looking at the Wi-Fi infrastructure, our wired infrastructure, to ensure that we have coverage to all the key areas that need to be, that the hospital information system will need to interact with. Also, we will be looking at also technologies, tracking technologies like RFID. We'll be seeking to do the groundwork to introduce such technology in our environment. As we see the utility of this technology as it relates to inventory management, asset tracking, And also it can have utility in relation to patient tracking as well, and also medication management. So those are the kinds of things that we're looking at currently. Thank you.
Thank you, Minister. However, you've now prompted me to ask a supplementary question to my second question. And it is clearly an important part of that must be digitization of records. And because even although we treat patients from now, present, it is always a benefit in arriving at the correct diagnosis to know what the history has been. And access to history and good historical records is very important. I am aware, well aware, that digitization of x-rays and ECG runs and things like that is technical, complicated, and vast in terms of utilization of space on a server or whatever. So the question I'm asking is, how far along is the hospital or the ministry with its digitization? Because as you know, the push for the whole government is for us to move to digitization, a digitized platform. And I am aware that you may have records which you are mandated to keep for many years in rooms that may be bigger than this chamber or cumulatively. So I think you should give us an update as to where you are on digitization and when do you think you can actually move to a situation where going forward, patient number one would be totally digitized?
Thank you. I'll ask Minister Ishmael again to speak.
Yeah, thank you again, Honorable Member, for the question. As a part of the overall digitization and digitalization process with the health information system, will be the digitization of records. Now, the hospital, just like many other institutions in government, have already sought to engage and embark on the digitization effort, albeit in a very small way, in a very small scale. Now, once we have a health information system identified, where all of that information is going to feed into, which is the medical record of each patient, etc., then we will be able to have a more robust effort relative to the digitization of those very old records, as you would have mentioned, patient records. I would allow Director Bob to come back in to speak more towards this, but just to let you know that digitization is a very important part to digitalization. So once we have the platform that is in place, then we can have the records that go into that system. And it is important to ensure that we select the right health information system that would allow us to then be able to digitize smoothly for whatever period of time backwards. As you rightly did mention, there is data retention policies, which means that there are certain files that we have to keep for certain lengths of time. So we have to keep those things in mind. And that also then adds to the volume of data that would have to be digitized. So it is a lengthy process. This is not something that's going to happen overnight, but we understand that the most critical step in this process to have the health information system identified and procured, which is going to happen during the course of this year, this financial year. And that would allow us then to be able to have a special project that's developed to be able to do the digitization of those health records based on the retention policies of government and of course of the QAH. So I'll let Director Bob come in and she can also add some more technical detail to the digitization efforts already underway and what is planned as well.
There's not much more that I can add to Minister Ishmael's presentation, except to say that we did have some experience before in digitization when we made an attempt with a different application, and we understood what it meant to undertake the process for all of the records that we have on hand. We've not had much disposition of those records, so we had to make a decision on how far we would backfile and convert from manual to digital. And that decision was made, and I'm pretty certain that has set a precedence for how we continue to, in this new dispensation, and as Minister Ishmael has indicated, it will take some time, but we have an idea of how far we should go back and where we should start with the new from patient one. It requires some infrastructure as well and additional staff because it is many records that you will be converting and many, the conditions of the records, depending on how far we go back, is also a consideration. But we are quite confident that it is a project that we would get done, and it will be sequential to when the HIS solution is implemented. The timing of digitization and that will be critical. Thank you.
Thank you, Director Bob. Clearly, and of course, you didn't mention, but clearly when you digitize patient records, security becomes absolutely paramount. We all heard of the breach that you had, and in fact, the minister spoke about it, and it's all the more reason why you have to have security and testing of that security before you go live on things like that. My final question, Mr. Chair, and you know, at no time can health come in well and I not reflect on my previous profession. And at a previous estimates meeting, we were given the assurances, and I want to know how far along we have gone since I was given that assurance. We were given the assurances that there were going to be significant improvements in the provision of dental health services to the people of Barbados, not only in the hospital, but also throughout the ministry. As you know, that the ministry provides dental services, limited dental services in the polyclinic service. And at a previous estimates, we were assured that there would be significant improvements to that. So I'm asking now, as I see you do have another set of money to be given to the dental services, to be spent on dental services, what improvements have been given, have you done over the past couple of years? And what further improvements do you plan to do to be able to enhance the provision of dental services to the people of Barbados?
Thank you, Honourable Member. I will speak generally, and then I will pass over to the Chief Medical Officer, and then Mr. Harris can speak to progress in the QEH. Generally, we have been upgrading our dental facilities in the various clinics. I think with St. Philip is probably the worst that is still to be done, St. Philip Polyclinic. We have acquired additional chairs, we have acquired equipment, and I'm happy to report that we have now recruited additional sessional doctors. I made reference to one earlier that is very familiar to the Leader of the Opposition. And we have been doing much better in terms of the patients that we are seeing. As it relates to the orthodontic and facial maxillary matters in the QEH, regretfully, we have not made a lot of progress. We are trying to get cracking and going with the joint replacement programs and the cataracts, and now our focus is on gynecological. But we're looking at when we get all 12 theaters running, that we can then focus on adding that as additional group of area of surgery that we can perhaps get into. But I'll ask the Chief Medical Officer, who has direct responsibility for this, to speak a bit more.
Thank you so much, Kenneth George, CMO. Let me make a general comment first. The Ministry of Health has not been able to attract dentists to the public sector. That's a fact. If you look at the information I have to hand, 95% of the dentists in Barbados are attracted to the private sector. There's not much incentive for them to come to the public sector. What we have done, fortunately, there were 5 sessional posts that were created. I'm aware that 3 of those 5 sessional posts are filled, and therefore we are able to offer a better service. But as the Minister has indicated, all polyclinics are not up and running. We still have significant challenges with respect to our human resources to cover all the clinics. And we will continue to work with the private sector. The only solution out of this quagmire is to have all the posts filled. There's a post of senior dental officer and 2 dental officers. I think only one of the dental officer posts have been filled at this point in time. and making sure that we have the 5 sectional dental posts all filled to give a basic set of services. With these services, though, we will still only be able to concentrate on children and obviously emergencies in adults. We don't offer some services. We don't offer services like we offer very basic extraction, etc., but we don't offer reconstructive type services in dentistry in Barbados in the public sector. I hope this helps.
And of course, my follow-up question then. Oh, someone else is going to. Oh, sorry, Dr. Harris. Mr. Harris, sorry.
Anthony Harris, Director of Medical Services. We remain committed to providing operating space to the dental surgeon from the Ministry of Health. As Dr. George alluded to earlier, that position is a little nebulous at this time, but he certainly have access to the provision of dental services, particularly for children, at the Queen Elizabeth Hospital on Thursday morning, once a month. And as we said, when we can get all of our theaters in service, that we should be able to expand that availability even further.
Thank you, Mr. Harris. Of course, that brings on then my follow-up question, because in the past, we used to have a lot of dental therapists who would have provided a lot of services for children especially, which supplemented the service very well, and they worked very well together with the practitioners. And I know with the closure of the school in Jamaica, then that has put significant strain on the service. Have you been able to find anybody or any school that is willing to train other dental therapists to be able to add and supplement the service?
Thank you. You're correct with the closure of the school in Jamaica that has put strain on us. But I know that the senior dental officer was trying to get persons overseas to explore other avenues. In the interim, I was approached about a possibility, and we'll be very cagey and guarded, of having the person who was involved in the school in Jamaica, there might be a possibility of getting her, encouraging her to come and live and work in Barbados and establish a facility. I haven't told the Minister of Education yet, but through Barbados Community College, where we could have our own little school here under her, because she was involved in running the one in Jamaica, and not only train Barbadians in dental therapy, but also have make it profitable for BCC by offering training also to persons from the OECS. But that is something that I am working on quietly. Not so quietly now.
Thank you very much, Minister. Clearly, the Ministry of Health continues to be integral to Barbadian life and Barbadian society, and I commend you on how you've been able to take charge of the ministry and to continue the good work of the Ministry of Health. Mr. Chairman, with those few words, I yield back to you. Thank you.
Thank you, Honorable Member. Honorable Member for St. Andrew.
Thank you, Mr. Chair. Interestingly enough, my first question was related to infrastructure development and also dental upgrades. I was still asked it. You alluded to infrastructural work and some civil works going on at the QH, but my question is whether any of this infrastructural improvement will extend into those rural parishes. Certainly in St. Joseph and St. Andrew would have seen and enjoyed the benefits of infrastructural development over the last 2 years of their outpatient clinics. But I'm curious as to whether in your plans, if you plan to put a bit more effort into expanding healthcare into those rural parishes where there are limited options in terms of private practice. St. Andrew, for example, has no private practice at all. We only have access to one facility we have in parish, which brings me to my main question also, which is, are there any resources in the estimates this year for the St. Andrew outpatient clinic, which for the past 2 years has been functioning for only 2 days in the week, on Mondays and on Wednesdays, and even in those days, it has not been open for an entire day in some cases. And this has been 2 years that I've been asking for that facility to be open at least 5 days a week, like most other clinics. So are there any funds, A, for the enhancement or upgrading of some of these rural healthcare facilities? And B, if there are any funds available for staffing, I believe it was a staffing issue a few years ago, for staffing the facility in St. Andrew. I believe the same obtains for the facility in St. Joseph. I don't believe anything has changed for those 2 clinics which were recently opened. And also, we don't have any dental care. So since the honorable member mentioned it, are there any plans to also include in some of the rural parishes dental care facilities as well? That's my first question.
Thank you, honorable member. You've answered a number of questions. You said it's the first question. You started off with infrastructure, and I mentioned earlier, not in detail, about plans to do an entire refurbishment of all the polyclinics. And in that plan that we're looking at refurbishment of 7 polyclinics and rebuilding 2, the Randall Phillips and the Eunice Gibson. And we're looking to, as I said earlier, to a whole package to seeking funding to refurbish, expand, because there needs to be a renewed focus on primary health care in Barbados. I think some of it, we have drifted a bit in primary health care. We have focused on the QEH, tertiary health care, which is important. But we also have to recognize that once we can identify the disease processes early on, we can make interventions early on, we can have better patient outcomes, and then certainly we can reduce the need for the QEH. If we pick up a number of these issues, these diseases, these concerns, these cancers early, then we don't necessarily have to, but we can ease the load on the QEH. So this is the plan. Meanwhile, there are plans, and I'll ask the technical officer to speak to it, to do works, renovations, roof repairs at a number of polyclinics. You keep speaking about rural polyclinics, and there's plan for work to be done at Randall Phillips. I don't know, you might not want to call that rural. St. Philip Polyclinic, Morris Bay Polyclinic. And Eunice Gibson serves serves Horse Hill and St. Thomas when it was open. And we're breaking plans now to refurbish that. And the matter of resources is more than finance. We have a shortage of nurses. And right now, even in our polyclinics, we don't have enough nurses. And that's why we're using Ghanaian nurses, and we're looking to recruit more nurses. So I have no doubt once we get the nurses, then we can utilize them better. At the point in time, I can't see us offering 5 days at this point in time to Belle Plaine and to Horse Hill. We'll certainly make efforts to see if we can increase it by a day or so, but we need staff. That is the main issue. The dental clinics, we are struggling.
To move that you do now report progress to His Honor the Speaker and beg leave to speak again.
The question is that I do not report leave to Her Honor the Deputy Speaker and beg for leave to sit again. All honorable members in favor, say aye. Honorable members against, say no. Methinks the ayes have it.
Honorable members, the chairman has reported progress and has asked for leave to sit again. Honorable member.
Thank you, Madam Deputy Speaker. I beg to move the suspension of the House until 2:15 p.m.
The question is that this House, this honorable chamber, be suspended until 2:15 p.m. Honorable members in favor, please say aye. Those against, please say no. Methinks the ayes have it. This session is suspended until 2:15 p.m.